Many people look forward to summer vacation or day trips to special places to celebrate holidays because of the exciting, unique experiences they will have with family and friends. I have memories of visiting Cape Cod with my family and being able to spend time with my cousins, aunts, and uncles who I rarely saw, soaking up the sun as much as we could before we had to go back home. I also remember the most incredible traffic jams, packed restaurants and venues, and highly concentrated crowds of people. As a child, I couldn't begin to understand the complex relationship that exists between tourists and locals, especially small business owners who depend on the tremendous influx of people every summer to support their work. As I got older, I realized how frustrating it must be for so many people to have their lives disrupted in such a drastic way at certain times of the year. And of course, the COVID-19 pandemic posed further complications. From a pretty young age, I was aware of the presence of the LGBTQ+ community in Provincetown, Massachusetts. Provincetown also has a large percentage of individuals living with HIV or AIDS, approximately 7% of the year-round population. The LGBTQ+ community has been and continues to be deeply affected by the HIV-AIDS epidemic, and Provincetown is considered by many to be a safe haven for people with the disease. This summer, a friend of mine who was vaccinated against COVID-19 went on vacation to Provincetown, where she contracted and subsequently tested positive for the Delta variant of COVID-19. This spurred me to think about how we truly need to be so careful when traveling to these high-density areas, taking safety precautions, and being as respectful as possible to the people around us who may be at a greater risk of becoming extremely ill with COVID-19. My mother has an autoimmune disease, and throughout the past year and a half, our whole family did everything we could to ensure that she would not become infected. We were lucky that she never became sick, but many others with pre-existing conditions or autoimmune diseases such as HIV and AIDS were not so lucky. I'm deeply interested in the perspectives of locals and tourists on travel before and during the ongoing COVID-19 pandemic, and how their perspectives might compare and contrast in unexpected ways. I'm also curious to learn about how people who lived through the height of the AIDS epidemic, especially those who are members of the LGBTQ+ community, or people who have HIV or AIDS, or know people living with the disease, feel about the COVID-19 pandemic, and if they've drawn any parallels between it and the HIV-AIDS crisis. I think that people should care about this topic because if you're going to be traveling anywhere, it is always good to be aware of how that community views tourism, especially if there are other external factors at play. If an environmental or public health crisis, such as a global pandemic, is threatening the locals of an area, we should think about how our travel and activities could negatively contribute to the situation that they have to live with every single day. I feel a personal connection to this topic because I understand how scary it is to have a loved one be at a greater risk of becoming severely ill with COVID-19. I'm looking forward to learning more about the history and people of Provincetown, the tourists, locals, and anyone who is willing to offer their valuable insight to me as I delve deeper into my research.